Hi, everybody. Thank you for joining me this afternoon. That rendition of Baby Shark, my kids are 6, 8, and 10 now, and so we are well out of the needing to listen to Baby Shark phase, but I still secretly listen to that version of Baby Shark on my own without my children. So just put that in your back pocket for later. It'll come in handy. All right, welcome to Full Circles mandatory pregnancy webinar and orientation. Some of you, we just talked a little earlier today at your history visit. Some of you had your histories on a Monday or Tuesday, and some of you, hopefully, I'll be talking to tomorrow for your history visit as well. I think some were last week too. But my host should be sharing his screen right now. So please let me know if you're able to see the screen by raising your hand. All right, hands are going up, so we're going to get started. All right, so hopefully you guys have had a moment to grab some paper, grab some pens, because we have a lot of information to get through today. First, some housekeeping items. Everything that we go through today is going to be confidential for you, like in terms of the questions that you ask. So ask whatever you want to ask. There are no silly questions. I will answer everything to the best of my ability. If there's something that I think may reveal too much information about you and we might find out who you are by answering that question, then I might ask you to bring that to your next visit. Please participate. I have poll questions to make sure that you're still paying attention and you're getting all this information and that you're still awake at the end. So please participate. And it also helps me guide what I say next in the presentation. And then finally, if you have to jump off, we understand life. We're going to cut into dinner time possibly. Just know that this entire presentation will be available on our YouTube channel throughout the duration of your pregnancy. So first thing we're going to do is start with a poll so I can find out who's on the line, how many first-time moms, and how many veteran moms do I have on the line. So this is how the polls work. We'll put up the screen, you'll press your button, you'll lock your answers in, I'll bluff for a little bit, and then I'll say polls are closed. And the polls are closed, and this time we have more mommy veterans than first-time moms on the line. So for the mommy veterans, thank you for joining. There's still good information on here for you because pregnancy is frequently a blur. You don't remember what you did when, you just remember that some things happened to you along the way. So first time moms, so much good info. I know you guys have lots of questions written down. So hopefully you'll get those answers and be able to ask me some things along the way as well. So things we're going to go over today, we're going to go through the full circle experience, which includes where we deliver, office protocols, what to expect at your pregnancy visits. We'll give you some prenatal resources, talk about exercise and nutrition in pregnancy, and then close with a COVID-19 update. I know my veteran mamas, some of you delivered your first babies or maybe second babies during COVID, and some things have changed, actually gone back to normal. And so you can re-enter the hospital without trepidation. All right. Well, first is our philosophy, the collaborative midwifery model. So some of you came in as my private GYN patients, Dr. Merrow's private GYN patients. And so you're thinking, great, I'll just transition into having Dr. Merrow and Dr. Adams deliver my baby. Did you know Full Circle is a midwifery model practice, which is based on the fact that pregnancy and birth are normal life processes. So you don't need surgeons. I'm dressed like a surgeon today too. It's been quite a day. To cure you of some disease that you've caught. This is a normal physiologic process. That's what midwifery is based on. In the traditional midwifery model, we care for normal, low-risk women. But if there's some abnormality in the pregnancy, you may have to transfer out of the care to midwives to physician care. In the collaborative model, even if you develop some issue with the pregnancy, you can still remain in the physical care of the midwife, but with physician direction for the abnormality. So let's say you develop gestational diabetes. Dr. Merrow will manage the diabetes part of it, while the midwives still manage how your baby is growing, how your baby is positioned, what exercises and stretches you do, because it's still pregnancy. Now, to that end, the majority of our labors and deliveries are attended by our certified nurse midwives. They are the experts in normal physiologic labor and care of the newborn. If there is something abnormal or not physiologic about what's going on with your labor and it needs to be escalated, then they call physician consults while you're in the hospital. So urgent consultations, and there's a difference between urgency and emergency. So urgent is something that cannot wait until morning, but needs to be addressed, like stop dilating, baby's head's a little crooked, needs a little manual adjustment, they will call either myself, Dr. Merrow, or Dr. Mooney, and we are all about 20 minutes away from the hospital and happy to come in and help. If there is something that you do not have 20 minutes for, that is an emergency. And our hospital has OB hospitalists who are board certified OBGYN physicians in-house 24 hours a day for such emergencies. We don't frequently use them. To put it in perspective, last year we did 540 deliveries. Only 2 of them required the hospitalist to begin the delivery. And even with that, Dr. Merrow or I were available to come in. Before the baby, or really immediately after the baby was out, to continue taking care of the mom. Dr. Mooney will still come in, but she just wasn't with us last year, but she'll be part of that this time. So where do we deliver? Excellent question. Hopefully, most of you attended our town hall on Friday of last week. If you did not, it will be available on our YouTube, but we are changing facilities. We've been at Ascension St. Vincent's for the last 9 years, and we've had an amazing time there, but we are transitioning for numerous reasons, which you'll see on the town hall if you go back and watch that. On Monday, this coming Monday, October 30th, starting at 7 a.m., which means we will not be scheduling anything after this Friday, and we will be doing labor admissions at Ascension only until Monday morning at 6:59. So we'll stay at Ascension and finish up with anybody who we start there before 7 a.m. But after that, we will be focusing our attentions to the new facility, and they are so excited to welcome us there. Our office hours, the office is open Monday through Thursday from 9 to 1. We close for lunch from 1 to 2, and then we reopen from 2 to 5. So if you call us between 1 and 2, you will get a message that says you've reached the after hours line at Full Circle. The phones are not down. The phones are not broken. My staff is just eating lunch because labor laws. It's the right thing to do. So from 1 to 2, if you have something that is non-urgent, you can either leave a voicemail or you can just call us back after 2 p.m. when the front office ladies are back. If it is an emergency, because it's the after hours line, it does roll to our emergency on-call provider. So if there is something that is emergent, definitely follow the prompts to reach the on-call person so that you can let her know, hey, I need to come to the hospital. On Friday, we are open from 9 to 1. So if you are calling at 12:53 with an issue that is non-urgent, non-emergent, just know that the voicemail that you leave may be answered on Monday morning, unless it's a holiday weekend, which we don't get very many holidays. Appointments. Our goal is to see you as close to your appointment time as possible. To that end, we do not do walk-in appointments because we possibly promised that time to somebody else already, and we don't want you to just be sitting in our lobby not being seen. We have limited same-day appointments. So if you call in the morning saying, hey, I have an issue, I really think I need to walk in and be seen, front desk will take a look at the schedule for the day and add you on as they're able to. If they look at the schedule and there isn't an open slot, we may send you to our nurse, Tony, who will recommend that you're either seen in urgent care or that you go into labor and delivery. It's not us saying we don't want to see you. It's us agreeing with you that this is an urgent matter that should not have you coming to our office and sitting here for a couple of hours waiting to be worked in. So please don't be upset if they say, we can't see you in the office today, but we do think you need to be seen. We'll see you at the hospital. Phone calls. If you are calling the office about a clinical matter, you're not able to have the provider, you can't just call and say, hey, can I speak to Lauren? We're not able to leave patient appointments to take phone calls. So when you schedule appointments with us, we block that time off to talk to you. And so we ask that you show the same respect for other patients who scheduled our time during the day as well. You can speak with Tony. She handles most of our clinical matters, and she has a triage algorithm. And if there's something outside the scope of the algorithm that she's been provided, she knows how to get in touch with the provider on call and get an answer for you. You have to leave a message, though, to get a call back. We have seen sometimes where people will call and hang up and call and hang up and call and hang up and say, no one's calling me back. No one knew you called, because we don't check the caller ID and call back everybody who accidentally pocket dials their gynecologist. So please leave a message in order to receive a call back, and be sure you're leaving the message with the right person. How do I know it's the right person? That's a great question, because these are the people with whom you want to leave messages. So Tony, who I just mentioned, handles pregnancy administrative things. So she's also our triage nurse, and she does letters and forms. So if you have FMLA paperwork to be done, short-term disability, Tony is the one who ultimately completes those for you. Our OB clinical coordinator, many of you have already heard from her, Ms. Howard, Naisha Howard. So she's the one who sends you your blood work, your labs. If you have a referral, like you need to see a high-risk doctor or cardiologist or hematologist, what have you, she coordinates those referrals. You need home health, and at the end, if you need something scheduled, like your induction or your C-section or your tubal, Naisha is the one to do those things for you. If you have an insurance issue, many of you have everyone on here should have met Renee Hall already. She's our benefits expert. So, all of you are going to be pregnant around the turn of the year as well. So, if you are changing insurance, please let Renee know because we might be collecting on a prepayment plan that we don't need to collect on anymore, or your patient responsibility might have changed and we don't like surprise bills because we know you don't like surprise bills either. And if there's something you don't understand about why or what we're collecting, please reach out to Renee Hall and she can answer all those questions for you. If you need to reach a clinical provider after hours, that's what our emergency on-call line is for. So this is for, I think I need to go to the hospital. This isn't, oh, I forgot what Jane said to me in my visit today. Let me just call somebody and have them read her note to me. That's not what this is for. For this, you need to leave a voicemail in order for the phone to even register that a call came through. And it will say on there, give us 20 minutes. If we don't call back, call again. Because the same person who's taking the emergency phone call is also the person who's physically in the hospital. So if she's in a room pushing with somebody, she's not going to say, hold that crown. I'm just going to go answer this phone call real quick. If it's something that you feel like you need to come to the hospital for, just come to the hospital. Please don't have your baby at home on the floor, waiting for us to give you a call back. If you know you need to go to the hospital, please come on in and come to the place where you know we're going to be, because you'll very likely see the person who has the phone and was, for whatever reason, able to call you back. It's not often that happens, but just know that's the same person. And so only one person can only do one thing at a time. So, ways to contact us. The patient portal is another way to reach us, but please remember, response time can take up to 2 business days. So, if you send a message on Thursday, Friday is a business day, and Monday is the next business day. So, if this is something on a Thursday that can wait till Monday, then the portal is appropriate. Next. Sorry, you guys can probably already see the next thing. I have a lag over here, so I apologize for that. If it's a non-action item, like you send a message saying, "Oh, I wanted to know whether or not I can take these vitamins," that's something that doesn't require us to do anything, but just look at things. We may forward it to the person who's going to see you at your next visit and answer it at your next appointment. If you lost your lab slip and you know you're supposed to get your blood work done before your next visit, this is what the portal is for. We can always have Naisha email you another copy, or if you have COVID, you need to cancel your next appointment, you can send that message again if your next appointment is more than 2 business days away. And we can notify front desk and get you rescheduled, convert your appointment to a virtual visit. Things we do not want to see on the portal: urgent matters. Just today, I got a message about someone not feeling their baby move. Please don't send me that on the portal. That cannot wait 2 business days. If your blood pressure is sky high, or you're worried about your blood pressure, if you're not feeling the baby move, if you're having heavy bleeding, those are not matters that should wait for 2 business days. Please give us a call so that you can speak with someone about that. To that end, please don't send blitz messages. So blitz messaging is when you send a message to Lauren and 2 hours later you didn't hear from her. So you send it to Dawn and then you don't hear from her. So you send it to Jane, you don't hear from her. You're saying, I don't know who's on call, so I'm just going to send this message to everybody. One, it's portal abuse because, one, if you're asking for us to do something, having 5 people do the same thing in different silos is not the most efficient use of our time. We want to take care of everybody, and we can't do that if everybody is working on your one thing at the same time. Also, the computer will see that the same message is going out to multiple people, and it may think that you are a bot trying to spam us and shut down your portal completely, which is also something that you don't want because it's really hard to get those portals reinstated. And also, please don't attempt to have a whole visit during the over the portal. We will sometimes get people sending in messages telling us their symptoms, telling us things that they've already tried, asking for prescriptions, sending us lab results, sending us consultations from other doctors. That's a lot to do over the portal. We're seeing patients all day long. Afterward, we're doing our charts and cleaning up everything that we promise people during the day. The portal is something that we check in the evening and what's supposed to be our family time. So if you're able to have it wait until your next appointment, please have it wait till your next appointment. Text yourself questions. If you're like, oh, I know I'm not going to remember this, just text yourself to start a chat with yourself about your pregnancy questions or schedule an appointment because we're happy to talk to you about whatever it is, look at the labs, prescribe whatever you need during regular business hours. Ultrasounds are also released over the patient portal. That's also 2 business days, unless there is something urgent noted on your ultrasound. Our sonographers have been doing this for years and they know what things we want to hear about and not let people walk out the door. So if there is something urgently abnormal on your ultrasound, we will not let you leave the building until we take a look at that ultrasound with you, go over what the implications are, and make sure that a plan is in place, most likely a referral to a high risk doctor. Otherwise, we download the ultrasound reports from the machines, upload them to our electronic medical record system, and they get sent out to different providers to review, and then we review them and release them to you. So please give us a chance to receive them, review them, and respond. Quest also has a patient portal, and they're so efficient. They send you the results before they even send them to me, which is kind of annoying because they send them to you, and abnormal things or things that fall out of their reference range are red, which is a scary color on your labs, and it freaks you out. But just remember, they're not using pregnancy reference ranges. Pregnancy has physiologic changes, and red doesn't necessarily mean abnormal if you're pregnant. So please give us a chance to receive the labs from Quest. Sometimes we don't get them for 2 or 3 or maybe even 4 days after you got them. Let us review them and then let us release them with our commentary. Don't feel like you need to upload the labs into a portal message because then we're reviewing it there. And I promise you 3 days from now, when I get it again, I won't remember that you sent it to me. And that's creating double work for us as well. So just give us a chance to get them and send them out. Any questions on contacting us or, all right, cool. We'll move on to the next thing. Very good. Next, we're going to talk about what to expect at your prenatal visits. So remember that part about texting yourself questions. Pregnancy brain is real, y'all. It is. You will have a million questions when you walk out of this door. And there's something about walking into this building or really any building where you get prenatal care that makes you forget all of them. So start a chat with yourself today, Dr. A's prenatal chat, and just start a conversation so you can remember all those questions when you come in. Please wear loose, comfortable clothing so that we can access your belly. You're my winter crew, so I don't think we're going to have romper problems, but overalls might become a problem. We're in the fall season, so things that you have to unsnap and are very difficult to get out of. Just a shirt that you can lift up or skirt or pants that you can just pull under your belly so we can get to that tummy and listen to that heartbeat. We want you to arrive a minimum of 5 minutes ahead of your scheduled appointment so you'll have time to check in and take care of any administrative things you have at the front desk. You do not have to routinely leave a urine sample. ACOG is no longer saying that that is the right thing to do on a routine basis. You'll know if you need to leave one each time because we're either following you for blood sugar in your urine or protein in your urine, or you had a urinary tract infection and we need a test of cure. So we'll know if you need a sample. Otherwise, we know you're pregnant, you've been driving, just got to the building, you have to go to the hospital, run in, go to the bathroom, check in. That's fine. So we can see you at your appointment time. If you are 10 minutes late, we will still have time to check on you and the baby. So we'll check your blood pressure. We'll listen to the baby's heartbeat. We are going to hear the heartbeat at every visit, not an ultrasound, but the Doppler. But it does leave less time for you to ask us all those questions in your phone. If you are 20 minutes late, you have missed the entire appointment slot. If there is another open spot, front desk is really good about looking at the schedule and saying, Jane's appointment isn't going to make it, but there's a spot over here on Dawn's in 10 more minutes. And they may have you moved over before you walk through the door if you're past that 20-minute mark. If that time doesn't work for you though, just let them know and we can get you rescheduled to a day or time that works mutually for everybody involved. Diagnostic ultrasound visits. So the question I get is, well, when am I going to get an ultrasound? I want to bring my significant other or my family. Diagnostic ultrasounds are separate from prenatal visits. So the providers are not doing the ultrasounds. We have sonography techs to do those. The way to know whether you have one scheduled is to look and see if you have more than one appointment time, and is there a provider's name associated with your visit. So when Tina tests our imaginary patient, looks into her portal, she clicks on appointments, and Tina can see that she has two appointments scheduled. One at 9:20 with ultrasound. Ultrasound is not a provider's name. And then she has one at 10 o'clock with Dr. Yeckel. Dr. Yeckel is a provider's name. So Tina has two appointments, one of which is an ultrasound. So Tina can tell her family, hey, come hang out with me at 9:20. You guys can skedaddle or you can stick around for my 10 o'clock appointment. Totally up to you. Remember that the ultrasound visits will yield reports which are released to the portal within 2 business days, unless there is something urgently abnormal. In that case, say it with me, we will not let you leave the building. We will bring you over into a room, and one of the providers will break into her schedule and discuss the abnormal findings with you, create a plan, and we'll make sure that it is urgently addressed. When you're checking out from your regular prenatal visits, if your provider has said, oh, it's time for you to schedule an ultrasound, when you go up to the front desk, please let them know that you need to schedule an ultrasound also. Don't leave after just scheduling one visit. Be sure you're getting 2 visits scheduled because you'll need another prenatal visit as well as an ultrasound. Help us help you. We are sending messages from the back saying when you need an ultrasound schedule, but y'all are fast, man. Y'all pregnant ladies, y'all are quick. Sometimes you get to the front before the message gets sent from our computers. So if you know you're supposed to get one scheduled, please let front desk know. If you think you need an ultrasound, but we don't think you need an ultrasound, then this is for you. Boutique ultrasounds. So remember, ours are diagnostic ultrasounds. We have to have a medical reason to do them. Boutique ultrasounds, you don't have to have a medical reason. You can do it just because it's Wednesday. These are some cute places around town: Stork's View, Baby's Close Up, Sneak Peek. I know there's one in St. Augustine too. I always forget what the name of it is, but these are just for informational purposes. We don't endorse any one specific provider over another, but they do all sorts of cute things. Like they put the baby's heartbeat in a stuffed animal. You can get 3D pictures and all the CDs and USBs that you want with your baby's heartbeat and all that stuff, and bring your family. It's good times, good times. All right, so I think we have a poll question coming up now. So listen up. When should you expect routine ultrasounds? And the polls are going. The polls are open. All right, I know my veteran mamas are going to know this answer. And the polls are closing in 3, 2, 1, off. All right, at 20 and 40 weeks is the answer. So your routine ultrasound for anatomy is around 20 weeks. If there's something abnormal or something that we're not able to see on that, then you would get additional ultrasounds if you have a problem. But routine ultrasound, everyone's scheduled around 20 weeks. And then if everything looks good for the rest of pregnancy, you don't develop any other issues, you would get another one if you go past your due date. So 20 and 40 weeks. Good job. All right, I think we're going to head over to the website now. So you should see fullcirclejacks.com. This is our website. And you can see here at the top our message saying, hey, did you miss the virtual town hall and need the replay? Absolutely, we got you. Click here to watch the event and get all of your questions answered. So those of you who weren't able to join us last Friday and are wondering anything about our facility change, please, I encourage you to watch the town hall meeting, because I think it addressed really everything that's on everybody's mind. All right, moving on, the providers. So we have an amazing array of lovely ladies, one of whom will have the opportunity the distinct pleasure of helping you welcome your little one or little ones into the world. So there's me back when I had more hair. There's Dr. Marrow, and that's her current haircut. There's Dr. Yeckel, there's Dr. Mooney, and the midwives. We have a midwife Lauren, there's midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. All right. And this is all of our favorite thing to do. We rotate through call, so it's not predictable who is going to be the midwife on call when you deliver, but there is always one of the physicians backing our midwives. So you'll always have someone from Full Circle at your delivery. And you can click on our names and read a little bit more about our bios as well. Over here under the patient information tab, you'll see the obstetrics area. When you click on that, you'll know you're in the right place because you'll see all the bellies and then the baby at the end. So our information is out here. We are very transparent about our statistics, and many of you joined us because of our statistics. You're looking to avoid an unnecessary cesarean, whether it's your first, second, or third. So you can click on that and see our stats back to 2018. Here's the prenatal care timeline. We're going to click on that one and take a look at it together. So this is what to expect at each visit. So here we see, most of you know, we did our pregnancy confirmation. Our preference is to do it between 8 and 10 weeks. So everyone on this call has had their pregnancy confirmation visit at a minimum. You've met with Renee Hall and you got your invitation to your history with me, as well as your webinar. You should have received your baby pictures in the portal as well. When you have your history visit with me, that is where we discuss your medical history and I see if there's any additional blood work in addition to the routine prenatal labs that I want. But these are the routine prenatal labs. So again, transparency. We always let you know what labs we're offering and what labs are routinely run here. So you can see here with your routine panel, blood type, blood counts, some serologies, urine culture. Your homework is to have that blood work done as soon as possible. Some of you opted into genetic testing, some of you opted out. If you opted in, that has to be done after 10 weeks. And you have your option between the NIPT, which is the non-invasive prenatal test, or the nuchal translucency ultrasound, which is done between 12 and 14 weeks. Also, that falls right about 4 weeks after your confirmation visit. So you should be back in the office at that point. At this point in pregnancy, we're seeing you about every 4 weeks. So your second visit is typically your OB physical exam. If you are due for a pap test, this is when we would do this. And complete your prenatal panel with the STI screening for gonorrhea and chlamydia. If you need a high-risk referral, this is usually when they would reach back out to you if we sent it after I did your history visit. Then about 4 weeks later, you're coming back in and we're talking about what second trimester is like. This is when you start feeling those flutters and feeling the baby move. This is the fun time. That nausea and fatigue go away and you can really start enjoying your pregnancy before you get impatient and ready to meet baby. Then 4 weeks later, give or take, is about when we do our anatomy ultrasound around 20 weeks. Please note in the middle too, we also see that there is a mental health screen. So pregnancy, we are a holistic practice, which means you are a whole person. So not just a uterus, we're going to be paying attention to whether or not pregnancy anxiety or pregnancy depression are creeping in throughout the pregnancy. If you know that you are the type of person who cannot wait 2 business days and you want to know about the ultrasound, try to schedule an appointment with one of the midwives on the same day as your anatomy ultrasound. Give it a couple of don't do it back-to-back slots because there won't be any part of the report that's available to print out. But typically, if you have about 2 slots later, the sonographer will be able to print out some portion of it so the midwife can at least give you an idea of what was seen during your anatomy ultrasound. The midwives will also at that visit discuss childbirth education and or breastfeeding classes, both of which are offered at our new facility. At 24 to 28 weeks, we're going to be requesting the glucose test, and we're going to talk more in depth about the glucose test coming up. So if you have questions about that, please put a little pin in it. For my moms with a certain blood type, if your blood type is something negative, we'll be making sure that we have the special injection to protect future pregnancies in office to give you around 28 to 30 weeks. This is when we're going to be encouraging you to complete your online pre-registration at the hospital. You can schedule a tour at the facility. We also have a phone number that you can call the Director of Women's Services, and she does facility tours pretty much all day, in the evenings, on weekends, whatever is convenient for you and your family to come and see where you're going to welcome your little one. If you plan to work with a doula, this is when we want you to get her selected and logged in and locked in. And then after this visit, this is when we start going to the every 2 week visits. So you'll also see there in the middle, you have the option to repeat or decline the standard prenatal labs. This is from the Duval County Health Department, which you can imagine has different types of populations across the city. Some are higher risk than others for contracting STIs during pregnancy. If you feel you are low risk and don't need to repeat these labs, we have a standard decline form. It is not a big deal. Just let us know. We just need to have on record that we did offer it to you in your third trimester. Moms who are ready for their Tdap vaccine or booster can get this at this time as well. Some of you will be pregnant until I think most of everybody on here will be pregnant through March. And if you're planning to do your flu shot, you can do that at any time. For my first time moms, is when you want to start looking for who your pediatrician is going to be, because as much as I love you and your baby, once he, she, or they are out, they need their own doctor. For my veteran moms, you want to decide whether or not you're going to stay with your current pediatrician. Then with the every 2 week visits, we continue those until you're about 36 weeks. For my moms who already know for whatever reason that they're going to have a belly birth, which is our words for the C-section, we'll get that scheduled for you so that you can start to plan getting family in town and all that sort of stuff. At 36 weeks, you have one more pelvic exam. This is a screen for group beta strep. And you have, if you already declined doing the repeat STD screening earlier in third trimester, you're also declining the repeat gonorrhea chlamydia screening. So this is when we start seeing you weekly. So your birth plan, if you have one, you want to bring it in after this, because now you're going to be full term, and that's when birth plans come into play. And start your natural cervical ripening methods, which we'll talk about in just a moment. 39 weeks for the most part is usually when our belly birth moms are going to get off the train. And then 40 weeks, if you go past your due date, because babies don't have calendars, and first time moms, the average time for y'all to deliver is 40 weeks and 5 days. And the average length of that labor is 24 hours. So we start doing our post-dates testing, and you are going to be patient. And then we want everybody evicted by 42 weeks. So first time moms, we typically will schedule a labor induction at 41 weeks and 5 days. If you are a repeat customer, 41 weeks and 6 days, because second plus babies tend to be a lot faster. So remember, all this information is out there on our website. Please feel free to download this and stick it on the fridge, or I don't know, just keep it on your phone someplace so you know what's coming up at your next visit. All right. So some of you I've already talked to are having some things happen. You're having nausea, you're having constipation, you're having diarrhea, you're having headaches. If you have a headache, what are you more likely to do? This is a poll question. Would you take a Tylenol? Would you meditate? Would you go to the ER? And I think the poll question is popping up now. So let me know. I'll tell you, on any given day, I might do any one of these things: meditate, medicate. I probably will not evacuate, because that ER copay is no joke. If I can't, I got to try to at least get that headache gone myself. Polls are closed. All right, we have more medicators than meditators on the line today. Zero judgment. I understand. All right, so, and many of you have said, I haven't been able to take anything because I'm pregnant. False. Let's click on the pregnancy safe medications, just so you know that this resource is out here. So alphabetically listed on the left, we have a common list of pregnancy discomforts. In the middle, you'll see some relief measures. These are non-medicinal things that you can try first before moving to the medication side over here. So if you send us a portal message, Dr. A, I'm constipated, nobody told me pregnancy was this sexy. First thing I'm going to say is, are you eating your vegetables? Are you eating your fruit? Try some dried fruits, drink more water. And then if that's still not working for you, then these are the things I'm going to recommend. So just know, any of us who you mention who you message with anything on this list, this is the first place we're going to direct you. So y'all have started to get smart. When you message now, you say, all right, Dr. A, I've tried everything on the list. So I'm still having the problem. And those messages are fine. If you try everything, exhaust everything on the list, please reach out to us because there are always next steps after what's out here. It's not just suffer. The list also includes, as my wonderful host is highlighting, some instances in which we definitely want you to reach out and some things over the counter that we want you to avoid. So always please remember that this list is out there, because I promise every time you need it, it's like 2 or 3 in the morning and you're like, what do I do? I can't just suffer till the morning. So try these things here first and then let us know if none of them work for you. The next box is the gestational diabetes screening test. We're not going to click on that one, but remember that it's here because I'm going to refer back to it when we talk about GDM screening in a little bit. All right, weight gain in pregnancy. Some of you have also expressed to me, I'm so concerned I haven't gained any weight in my first trimester. And some have expressed other things. I'm so concerned I've gained all this weight and it's just my first trimester. All right, so this is your recommended pregnancy weight gain, and it is based on where you started. What was your pre-pregnancy body mass index? So you'll see here what the recommended weight gain is. If you're having twins, you can add 10 pounds onto the high number here. So the rates of weight gain you can see in that third column say in your second and third trimester per week. So don't worry if you haven't gained anything in your first trimester. Food doesn't taste good to you. All the baby wants is carbohydrates and you can't keep those down anyway. Plus you're sleepy half the time. Like how are you expected to gain any weight right now? Once all of this stuff clears up and you're feeling better after 13 weeks or so, then you'll be able to put on some of those yummy baby pounds. All right. There is a link here that you can click on to calculate your pre-pregnancy BMI, and that will let you know what you should be gaining during pregnancy. Birth preferences. All right. These are things that are leading us toward the end. So remember, he said toward after your 36 weeks, this is when we want to go over your birth preferences or your birth plan. So these are things that we used to see on birth plans all the time. We put things together so it's all in one place for you. You don't have to go scouring the internet trying to find what do I want to plan for my birth. So everything on here from how you'd like your labor to start to what you want to happen in the hospital. Do you want to wear the hospital gown? Do hospital gowns freak you out? If they do, don't wear it. You want to design something on Etsy and come in with your baby's footprints or your handprints or whatever. I don't know. Whatever you want. Birth is messy. Whatever you want to wear is fine. Monitoring. For most patients, intermittent monitoring is an option. There are some instances in which we need continuous monitoring. And in those instances, we still have the option for wireless monitors. So there are enough wireless monitors to not inhibit your activity during labor. That's really what I want you to see out of here. We're not strapping you down and starving you. That's the most important thing. So some of the, I'm sorry, if you'll scroll back up to my wonderful host. So some of the options that are on here you see for comfort measures as well as for pain relief. We have hydrotherapy on there, and hydrotherapy is labor tubs. So for full-term moms who are 37 weeks plus, if you want to labor in the tub, that is a thing. So you can definitely do that. Of course, it's a hospital with epidurals and IV pain medicine, but I wanted to highlight that nitrous oxide, the gas, as well as hydrotherapy will be available starting October 30th. Okay, now you can go ahead. So then positions, you can see positions for labor, positions for pushing, positions for delivery. We really don't restrict that unless there's some medical reason that we have to. If you have sky high blood pressures, I'm not going to stand you on your head. That's not a good idea. Our usual is slow delivery of the head to try to avoid perineal tearing. We have oils that we also use there. If you want to bring your own oil, that's fine too. Delayed cord clamping, immediate skin to skin, early breastfeeding, all of those things. There is a list on here of the standard medications that are offered to the newborn. You always have a chance to, come in and ask the midwives, hey, is this for me? What is this for? Why are they offering me this? Does this apply to me? And we can help you to formulate some of these things. Good doulas will also go through each box with you and help you know which things are salient to you. Everything on here is a matter of opinion. In terms of feeding, the hospital will encourage breastfeeding. Obviously, if there's some reason why you need to give formula, that's fine, but we won't be doing it behind your back. No pacifiers, no bottles, and no formula unless you tell us that it's okay. For my twin mamas who are on the line, we've had special conversations about how twins make things twice as nice. And then for my belly birth moms too, we do offer gentle cesareans, which is a term that Full Circle has coined. And it's not either I have a vaginal delivery and get everything I want or have a C-section and get nothing. It's still a birth. So I encourage you to look at some of our media that's going to be coming out very soon about the principles of the gentle cesarean. So as we go back to the website, just know that this can seem daunting, but just it's 21 boxes. If you take one box at a time per week, you'll have plenty of time to put down the things that matter the most to you. All right, this next box is about cervical ripening techniques. I mentioned those. You're going to start those about 36 weeks is when you really hit those hard. But these are things that at the end of pregnancy, you say, Dr. A, how do I get this baby out of me? And this is a list of things that you can start. You can start raspberry leaf tea as early as 20 weeks, but there's evening primrose oil, there's clary sage, there's dates, there's breast pump. So just take a look at this week by week, what we recommend to do. These things are not intended to put you into labor. They are intended to tone your uterine muscles and soften your cervix so that when your baby gives the signal for labor to start, your body is receptive to it to make your labor faster and more efficient. So remember that these are out here, and also remember that what is not on here is castor oil. And if you have an appointment with me, I will tell you why I did not put castor oil on there. All right, first time mamas, listen up. Also, do I have any moms who had a previous cesarean? Is there anyone here who's going for a vaginal birth after cesarean? And as you can see, there are only two options here because we are all positive. Oh, wait. Oh my gosh, are like all of my veteran mamas VBAC mamas? Okay. All right. So fantastic. Yes, and you're going to rock it. Love it. Many of y'all know I'm a VBAC mama. Dr. Miro delivered my VBACs, and she's a VBAC mama too. I delivered her VBAC. I attended the delivery of her VBAC. So your success is our goal. So first time moms, this applies to you too, because really it's y'all are just two different camps of people trying to avoid a C-section. So these are tried and true recommendations to make sure that you're prepared for your successful labor. Um, for my moms who had a cesarean before, fear release is major. Like, don't let your brain sabotage what your body can do. For everybody, chiropractic care, pregnancy yoga or Pilates, you guys can read. So all of the things on here, if you do everything you can, then you're in your best position to make sure that you get what you're looking for. We can't control what the baby is going to do while they're inside or outside. My veteran mamas know. But all you can do is control your own variables and do the things that will make you a great candidate for a successful vaginal delivery. All right, I think we can go back to the website. You guys may already be there. And first time moms, y'all get so tired at your due date because but it's my due date. I am due. Remember, babies do not have calendars. So please, if you can avoid a non-medical induction before your 41 weeks, please avoid it. Some of my VBAC mamas are saying, I wish I had been a little bit more patient too. And just trust your body and trust us because we want you to have your best and safest delivery as well. Finally, if you're having a little guy and you want to have him circumcised, we don't do those in the hospital. We do them here in the office. You'll just let us know at delivery. We tell our OB coordinator, Naisha, and she'll send you a portal message with his little appointment time. And Dr. Mero Mooney and I will take care of him here in the office. We want to give him a couple of days to learn to be a baby, feed, and all that good stuff before we start coming at him for a circumcision. All right, we're headed back to the presentation. And the question I have here, any updated Webster certified chiropractic suggestions? And the answer to that is actually yes, and they are on the wall. When you come to the office and you come out of the bathroom, there's a wall of providers there. So everybody on there, there's like two rows of chiropractors. Everybody in that list is Webster certified. Great question. All right. So for those of you who are so concerned that you're in your first trimester and you gained so much, Dr. Adams, I don't know what I'm doing. I'm only drinking coffee in the morning. Are you really just drinking coffee, or are you drinking one of these salted caramel mocha monstrosities that I love so very much? All right. So And that's with 2% milk. Holy cow, I never picked up on that. Did you know pregnancy only requires an additional 300 calories per day? Not much. The amount of weight that you're supposed to gain is based on your starting body mass index, and it takes 10 calories to maintain 1 pound of body weight. So the calculation that we use in like just to put that out there, it's if you start the pregnancy at 170 pounds, it takes 1,700 calories a day net to maintain that. If you're supposed to be gaining 25 pounds, that's an additional 250 calories for a total of 1950. Divide that between breakfast, lunch, and dinner, and you have 650 calories per meal. Now, if you've eaten 650 calories, do not wash it down with 570 calories of mocha monstrosity because the baby does not know the difference between what the calories are, if it's food or if it's drink. Had a conversation today a little earlier about those who have been trying to limit carbohydrates. Either you had PCOS before or gestational diabetes before, or you're just trying to just limit carbohydrates. This is a nice reference for how much of your intake should be attributed to carbohydrates, protein, and fat intake. Don't forget sodium, because I'm going to talk about sodium a little bit later on. But this sodium contributes to gestational hypertension and swelling and gestational edema. The question that I have up here is it possible to lose weight while pregnant instead of gaining? Yes, your goal is not weight loss. Your goal is appropriate and adequate caloric intake. So if you are typically having a pregnancy intake right around 2,000 kilocalories is what we say. 300 are going to go to baby, 170 are going to be to sustain you. If you were more than 200 or 180 or 190 pounds, you may lose weight as the baby gains weight. And so your weight may appear to be stagnant. As long as baby is still growing when we measure the fundal heights and baby's getting everything he or she needs. It's a great question. But again, our goal is not weight loss during pregnancy, it's maintaining healthy weight. Great. Our next slide. You may already see the next slide. There we go. So what things can we eat, Dr. A? You can have fruits and veggies and whole grains and cereal. You're not going to give your baby a nut sensitivity or allergy or dairy sensitivity, so it's okay to eat those things while you're pregnant if you're craving them. For my coffee drinkers, you want to keep your caffeine at less than 200 milligrams daily. Please remember that caffeine is a diuretic. So if you're going to be drinking caffeinated beverages, just remember the 3-to-1 rule. You want to take in 3 times as much water as caffeinated beverage so that you're not dehydrating yourself with that. Other things that it is okay for you to eat or drink, herbal teas. These are our favorite in pregnancy: raspberry leaf, ginger, lemon, peppermint. They're all good for pregnancy. For protein, I know I have some weightlifters, some bodybuilders out there. You want to stick around 70 grams daily. You don't want to overdo it with the protein. I know there are some pregnancy diets that have you taking in 120 grams of protein. Do not recommend that. Protein stocked foods nowadays also are stocked with other things, and you will grow an 11-pound baby. Please don't do that to either of us. But 70 grams, you don't want to fall beneath that either because you don't want an underweight growth restricted baby. Deli meats. Yes, you can. As long as you microwave it for 30 seconds to make sure that you're getting rid of all the harmful bacteria. It does not have to be piping hot fresh out of the microwave, but just be sure that you've gotten that time in to kill the bacteria. Same with your soft cheeses. As long as they're made with pasteurized milk, those are fine as well. If you're buying it from Trader Joe's or Publix or what have you, just turn it over. If it says pasteurized milk, you're fine. If you can't determine whether it was made with pasteurized milk, then maybe you skip that cheese for the evening. Canned tuna, you may have 3 of the 4-ounce cans per week. That seems like a lot of tuna to me, but I don't know your life. Maybe you need more tuna or other fish than that. The question I have out here are probiotics safe to take? And yes, they are. And we'll be addressing that actually a little bit later on as well. If you need more fish, if you're pescatarian or just like fish, the FDA has a really nice guide on their website. So remember, this will be on our YouTube. You'll be able to access this slide. There's a nice guide out there about fish that you should be eating in larger quantities because they're high in DHA, which is good for baby's brain development. Those that you should eat in moderation, and those that you should eat sparingly or avoid away altogether, likely because of the methyl mercuries involved with those. So it's a long document. I'm not committing that to memory. Just know that it's out there if you need more fish. All right. Next, I think the next slide is already up. Thank you. Things you want to avoid are undercooked meats and fish. So that yummy ahi sushi that y'all love so much, that I love so much. That was the saddest thing for me in pregnancy. I couldn't eat it. Your medium rare steaks, oh, so yummy. Sorry, you will need to ruin your steak for the next 6 to 8 months and have it well done. For my kombucha drinkers, my kimchi eaters, those are fermented beverage and foods, and your body treats that as a form of alcohol, which we do not recommend. Same thing with actual alcohol. We do not know how much is safe in pregnancy, and so we cannot recommend it in any quantity. And then your sodium, you want to limit that to 1,500 milligrams per day. When you start turning your food over and looking at the nutrition labels, you will be appalled at how much sodium is in a regular serving of really just about anything. And if you start sending messages saying, hey, my fingers are swelling, I can't get my rings on, the first thing I'm going to ask you is how much salt did you take in? And the next question, veggie sushi, okay? Yes, like the rice wrap, the rice wrap and the rice and the vegetables in the middle, that's fine. Good question. All right. Any other questions about nutrition before we move into exercise? Okay. It is just fine for you to continue your pre-pregnancy routine unless your pre-pregnancy routine was doing nothing. You're just not going to feel like it right now. So in the second trimester, just know that your body is going to go through some physiologic changes that accommodate more aerobic activity. Your blood volume increases by 50%, which gives you more red cells, more oxygen, tensions, and saturation. So just listen to your body. You will return to being the Olympiad that you were before. But in your first trimester, just your body's going to beat up on you for a little bit. It is also okay for you to start a new regimen in pregnancy. It does not have to be anything crazy, but just remember the most common reason that I do C-sections is not big baby or baby in distress. It is malposition baby. Sedentary lifestyles tend to lead to malposition babies. Mamas who stay active during pregnancy, their babies are flexible and active participants too, and they can mold better during labor. For those of you with these cute little Fitbit watches, you're clocking your heart rate all the time, which I'm sure adds you more anxiety. If you start noticing that your resting heart rate goes up, that is normal. So when you're just sitting there doing nothing, your heart rate may be 10 to 20 beats per minute higher than it used to be before pregnancy. That's a physiologic change. Don't worry about that. That is normal. All right. There are some of you who are saying that walking is your aerobic exercise, and that's fine if when you walk, your heart rate is in the aerobic zone, which is 70% of your maximum heart rate. The maximum heart rate is 220 minus your age. So if you're 30 years old, your maximum heart rate, your starting number is 220. So your maximum heart rate is 190. 70% of 190 is 133. So if when you're walking, your heart rate is between 133 and 190, that is aerobic exercise. So your goal is to do the aerobic exercise for 30 minutes, 3 times a week. If when you're walking, your heart rate is below 133, then that is transportation. It's not exercise. And transportation is fine. It's important, but it does not count towards your exercise for the week. So make your own calculations and figure out where you're supposed to be. What kinds of exercises can you do? All the cardio. If you like the treadmill, go for it. Elliptical, yes. Running, do it. Swimming, my fave. Indoor bikes, absolutely. If you have a Peloton, my leaderboard name is Off My Meds 8. You follow me, I will follow back, and we will get some blue dots on the board. You guys have kept me very honest and on top of it for the last several months. If you were weightlifting, it's okay to lift whatever you were lifting pre-pregnancy. You do not need to add resistance during pregnancy. Your baby and your body will do that for you. If you are squatting, squats are my absolute favorite in pregnancy. You want to build up to 50 squats a day. That gets that pelvis open, lets that baby descend into the right position. If you are an experienced squatter, wherever you start, go right ahead. If you're just starting out squatting at 20 weeks, I want you to give me 5 a day. 21 weeks, you're going to give me 10 a day. 22 weeks, 15 a day. So we're building up to 50, and that's 50 in a 24-hour period. So you can give me 25 when you hit the floor in the morning and 25 right before you go to bed. Pilates and yoga are also two of my favorite because they do also get those muscles long, lean, and stretched out. Any experienced provider will be able to tell you which pregnancy modifications are appropriate in order to do your Pilates and your yoga instructing courses. Things you want to avoid, it's the high intensity intervals after first trimester. It's not the intervals, it's the intensity. You can do the low intensity version of these, but you don't want any sudden jerking movements that cause shearing of the placenta. Lying flat on your back for excessive periods of time, like excessive ab work. You can do side lying abs, you can do standing abs. Hot yoga, unless you are a hot yoga instructor and are fully acclimated to that environment, you want to avoid that because you will get dizzy and you will pass out. Scuba because of change in barometric pressure. Same thing for high altitude hiking. If you have family in Colorado, you can visit them for the holidays. Just don't go hiking with them. Contact sports. Please don't take up kickboxing now during pregnancy. This is not the time. Somebody kick you in the belly. And outdoor biking after 16 weeks has an asterisk next to it as well, just because it is not the biking itself. It is that your center of gravity changes at 16 weeks. And when you try to turn corners, you may end up actually falling onto the corner. So just be mindful of that if biking is your exercise of preference. All right. Now that we've talked about diet and exercise, my poll question is, can you prevent gestational diabetes with diet and exercise? Like if you follow all the rules, can you keep yourself from becoming a gestational diabetic? My veteran mamas already know the answer to this question because this is the hill I will die on. All right. Polls are closing in 3, 2, 1. Close. All right. The answer is false. You can't prevent it. The key word here was preventant. Let me tell you why I screen everybody for gestational diabetes, because you all have the exact same risk factor. It's not your weight. It's not your family history. It's not having PCOS before. It's none of those things. It is the fact that you have a placenta. The placenta gives off hormones. And in any other situation, you'll believe, oh my gosh, it's my hormones doing this to you. Guess what? This is your hormones doing this to you. It gives off hormones that tell your insulin, you don't have to do your job today. And unfortunately, insulin's job is to clear your bloodstream of glucose. So if insulin's not doing its job, you're going to have all this extra glucose circulating, which is the very definition of diabetes, which is why it is gestational diabetes. It is not a judgment on your life or your lifestyle. As long as you have a placenta, though, I need to make sure that your placenta is not up to no good, making your insulin too lazy so that you have excess circulating glucose. We screen everyone universally, as you can see on this screen. So my moms who say that but I never eat any sugars. You eat some good carbohydrates. Don't avoid your good carbohydrates prior to the test, like your fruits and your whole grains and things like that. It's okay to eat those things because we want your body to tell us what it normally does with a certain amount of glucose circulating. If the actual drink is the problem, we have options. So the Simply Pure drink is one that we have for sale here at Full Circle. It is soy-free, it is dye-free, it is gluten-free, it is BVO-free, it is kosher, it is vegan, it is offensive to almost no one. There are additional patient-driven options on the website. Remember that box we did not click about gestational diabetes. So fresh test, glucorganics, and glucose tablets are also available. And on our website, you can see the links to those at fullcirclejacks.com. So this occurs typically around 24 to 28 weeks. As you continue preparing for birth, childbirth education classes, when you talk to the midwives around that 20-week visit, they're going to give you some of this information as well. So method classes, there are some of you who are seeking unmedicated births. There are some who are just seeking that the epidural they don't get it too early so that they, decrease their chances of a vaginal delivery. So hypnobirthing, hypnobabies, Lamaze, Bradley method. These are some of the instructors that are in our community, and these are listed for informational purposes only. Again, not endorsing any one over the other or any one over somebody that you might find that's out there. Next, there are some other courses that you may be interested in, breastfeeding classes. As I mentioned, HCA Florida does have an amazing lactation consultant who does breastfeeding consultations. She does one-on-one and she does group ahead of time or even afterward. CPR for parents. Every new parent should know CPR. Even if you knew adult CPR before, it's not just doing it with one finger. The intervals are different, so please learn it for infants. Chiropractic care, we do, as I mentioned earlier, have relationships with many Webster certified chiropractic chiropractors in the area. Webster is a special certification that deals specifically with pregnancy and alignments to make sure that baby descends into the pelvis appropriately. All right, my next question is about doulas, I believe. How many of you guys are planning to work with a doula? And we're going to talk about what doulas are because I'm sure some of the answers will be like, what is that? I have to work with more people? Why am I hiring y'all? All right, because we get the baby out. That's why. All right, very good. Okay, polls are closed. Fantastic. So we have a lot of yeses and some who are unsure. Fantastic. All right, well, let's talk a little bit more about what doulas do. Like, what's the difference between a doula and a midwife? So, doulas are for physical and emotional support. Midwives are medically trained in terms of physiology, anatomy, physiology of normal labor and delivery. So, midwives are basically like they were registered nurses first. They have their bachelor's of science in nursing. Then they went back and got a midwifery, actually became nurse practitioners, so advanced practice nurse practitioners, they're ARNPs. And then they had another master's in midwifery care. So doulas are there for physical support when you are planning either an unmedicated delivery or if you have anxiety about childbirth. Doulas are there to help you get into positions to make labor more comfortable, to advocate for you, to help you express your feelings, to help you remember why you wanted to do things the way you want to do them when you're in the labor room and in the moment. Acupuncture is also available in pregnancy massage. Those are people on the cards as well too. The best doulas are the ones who will maybe come to a prenatal visit with you, help you with your birth plan, show up at your house when you think you're going into labor, come with you to the hospital and stay with you until that baby is latched. So those, if you are wondering, I think I would like one of those doulas. Ask the midwives. They have no shortage of opinions on the doulas who work the closest with us and who we've seen support our moms well over the years. Full Circle has always supported having doulas in labor too, because advocating for the patients is, I mean, they're there with you the whole time. We may have two or more patients on the floor at the same time, and we may not be in your room the entire time. Your doula is going to be the one who stays with you that whole time. I think the next slide is already up for you. Some of you have insurance companies that will cover breast pumps. Please be sure to scan the QR codes in our exam rooms for the breast pumps. Please don't go looking for your own company that covers it, because a lot of them send us back pages and pages of forms to fill out with unnecessary information. What was your dog's name in the third grade? Like, I don't know. I just want to be able to sign the prescription and get you your breast pump. And we found a company that makes it really easy for us, and people get the breast pump that they want. And really, isn't that what both of us want? Just to do this very easily. So please scan the breast pumps. Around 20 weeks is probably a good time to do it. You'll be able to get it in plenty of time before baby arrives. They'll send you the information. You can pick out which one you want. They'll contact your insurance. This company's amazing. Postpartum, because one day this pregnancy will end. Blood pressure checks for my moms who've had any issues with blood pressures during pregnancy. We will be having you come back to the office sooner so we can make sure that postpartum preeclampsia is not occurring. Preeclampsia is not just prenatal. It is most common and most dangerous in the 14 days after baby is born. If you've had a belly birth, you'll be coming back in for an incision check. We'll also be checking on those who had certain scores on their routine mental health screens. We'll check in with you sooner as well. Postpartum doulas are a thing. And so remember, if doulas are there for emotional and physical support, when do you need that more than right after you've had a baby? So we can also give you information on postpartum doulas. The motherhood space, I am so excited to say that Jacksonville is one of 5 pilot cities in the country. Dr. Jill Garrett secured a grant for us to be able to provide this amazing postpartum resource. So if you're struggling in the postpartum period, you do not have to do it alone. I know some of my veteran moms who are on here had your babies during COVID, and that was a very isolating time too. This time we can work through this together. And then pelvic floor therapy is a major part of your postpartum care. So much so that we have enlisted a nurse and contracted with her to come to our office 3 times a week to provide pelvic floor therapy to help you put it back like we found it. Leaking urine, sensations of pelvic heaviness, recovering from any lacerations or tears or repairs. Pelvic floor therapy is instrumental in getting you back to feeling like yourself, so you can continue to enjoy the other parts of your life too. that babies sometimes wreck. Random frequently asked questions. Yes, you can sleep on your left side, your right side. You can sleep on your back too. You can. If it freaks you out to sleep on your back, or you are waking up dizzy from sleeping on your back, you can get one of those wedge pillows off of Amazon, slide it under one of your hips, and then you won't roll onto your back. You can paint the nursery as long as you're in a well ventilated room and wearing your mask. Probiotics, as we had the question earlier, and probiotics are okay to take in pregnancy as well. You can dye your hair, including your eyebrows. You can do gel nails. If you're going to the salon, be sure you wear a mask so that you're not breathing in those fumes. Everyone around on here is going to be pregnant over the holidays. So you're asking about holiday travel. Car travel is fine up to 37 weeks. Just be sure that you're getting out and stretching every 2 hours. After 37 weeks, we want you to stay within 50 miles of the hospital. With regard to flying, flight is also okay for my twin mamas up to 32 weeks, for my singleton mamas up to 36 weeks. Just be sure that you are wearing compression hoses, drinking as much water as you can while you're on the flight, getting up to go to the bathroom, which will be a result of drinking all the water, and then doing your toe raises when you're sitting in the seat. For your skincare, you can use your benzoyl peroxide, your salicylic acid, just nothing that has retinol in it. If you want to use a retinol substitute that's safe in pregnancy, there are many natural products with the ingredient bakuchiol, Bakuchiol, which is a good substitute for retinol when you're in pregnancy. And back to the question, I have one question up here. I'll answer that in just a second. So, things you want to avoid: roller coasters and water slides. So, really, it's just my summer pregnant crew that I usually have to say this to. And the next question is castor oil okay topically for skin and hair? Yes, it is. Yes, it is. Okay, and so the question I had was back to nutrition. Is it okay to drink raw milk? We want you to avoid anything that is not pasteurized, sorry, during pregnancy. All right, good questions. All right, quick COVID-19 update, and then we're done. Thank you guys for hanging in there. In terms of vaccinations, ACOG moved towards strongly recommending them based on the outcomes in the 35,000 pregnant women study done in 2021. It's published in the New England Journal of Medicine. Moderna and Pfizer are approved as manufacturers for pregnancy. Johnson & Johnson is not recommended because of its independent risk of blood clots. Pregnancy has its own risk. We don't want to add that onto it as well. With regard to boosters, all vaccines are approved for booster injections. If you're more than 6 months past your second injection of Moderna or Pfizer, you're okay to get another one of those. If you're 2 months past a Johnson & Johnson, you can get a booster, but not of Johnson & Johnson. And mixing and matching is okay. So if you had Johnson & Johnson, it's been more than 2 months, you can get a Moderna or a Pfizer. With regard to timing these versus flu vaccines and Tdap, they work differently, so you can do them whenever is convenient for you. You don't have to space them apart. If you can track COVID, there are no formal recommendations for treatment with ivermectin, azithromycin, or Plaquenil, so we do not prescribe those. What we do recommend is the vitamin regimen that's on here: vitamin D3, zinc, vitamin C. We also recommend adding a low-dose aspirin of 81 milligrams daily until you're 36 weeks. Because we have seen increased instances of gestational hypertension in moms who have COVID during pregnancy, taking a baby aspirin reduces your risk of conversion to high blood pressures of pregnancy. And then we'll start serial growth ultrasounds to make sure that narrowing blood vessels and increasing high blood pressures are not restricting baby's growth after you've had COVID during pregnancy. If you do catch it, recommended treatment is just supportive at home. You really only need to go to the hospital if you're having difficulty breathing, or if you have a fever that's greater than 101 and you can't bring it down with the recommended dosages of Tylenol. Next. The visitation at the hospital for my veteran mamas is back up to normal. So you can have your 4 visitors. Your certified doula does not count as one of your visitors, as she is part of our team, the labor team. You're not required to wear masks in the hallway or in the room or in labor unless you actively have COVID at the time of delivery. And even if you do, we're not separating moms from the babies. You're given an isolette so the baby can stay in the room with you and still be protected from the respiratory droplets. And we give you N95 masks. All right, my last question. All right, what can you find on the website? This is for my most common portal messages. Can you find birth preferences? Can you find safe medications in pregnancy? What to expect at each visit? Or were you a star test taker in elementary school, and all of the above. FYI, that is the correct answer. Polls are closed in 3, 2, 1. Thank you guys so much. Again, want to remind anybody who did not get a chance to view the town hall that it is still available on our YouTube channel. You can go to the website and click it, and it'll take you right to it. And remember, we are social, so please follow us on all the things. We will very likely be going back to some of our awesome birth stories that we used to tell back in the day. We got a little behind in those for a while, but mamas are asking again, hey, I'm an amazing birth warrior. Why didn't my baby make it to the page? So just know that In Her Words is coming back, and that is where mamas tell their awesome stories. Many of you came here because you heard somebody else's amazing birth story, so please pay it forward. We want to remove the drama and the trauma from birth stories and just let people know that birth really is still beautiful. And so are all of you. Thank you so much for joining me today. I appreciate your time. I appreciate you choosing Full Circle, and we look forward to taking care of you and seeing you again real soon. Bye, guys.